We will beat the coronavirus, and we will beat it together. And therefore, I urge you, at this moment of national emergency, to stay at home, protect our NHS, and save lives.
The nation watched as the Prime Minister made this unprecedented announcement. The country was to go into lockdown. The abiding question remains, though, did we do this soon enough? Channel 4 News has now seen a paper prepared for one of the scientific committees advising the government, which called, in the starkest possible way for a lockdown, a full 2 weeks before that announcement was actually made. We believe that this was the first paper written in the UK warning of the implications of not changing the strategy that was in place at time. This paper says that by not doing anything about that strategy, there could be 1.7 million deaths in the UK in the first 18 months of the pandemic. Now, it was written by Professor Stephen Riley of Imperial College, and it was prepared for SPI-M. That's the modelling group that feeds in to the government's scientific advisors. In his paper, he found that if the government continued on the course of mitigation, in other words, not locking down,
critical care facilities in the UK would be saturated quickly. The country would then have to either struggle on to the availability of a vaccine without a functioning health system, or attempt the most stringent possible interventions to lower incidence back to containment levels.
We have been unable to confirm that SPI-M evaluated the paper, and we were unable to reach Professor Riley for comment. A week later, however, was the Cheltenham Festival, attended by 250,000 racegoers, and there was the Liverpool Champions League game against Madrid. Professor Riley raises the question of herd immunity as a consequence of following mitigation rather than containment, that is, allowing people to become infected, a controversial strategy that the government was forced to deny it was pursuing. Professor Riley later acknowledged he believed it was not the government's goal. This is how the countdown to lockdown looks. The first UK COVID-19 death was announced on March the 5th. 4 days later, Professor Riley writes his SPI-M lockdown paper. That's also the day Italy went into lockdown. On the 12th of March, the UK moved from containment to delay, and Public Health England stopped contact tracing. On the 16th of March, Imperial's paper advocating for lockdown was published, and 1 week later, the Prime Minister announced that the British public should stay at home. We were finally locked down. Today, Professor Neil Ferguson from Imperial, and who co-authored that March 16th paper, became the second senior scientist this week to say lockdown should actually have happened earlier.
The epidemic was doubling every 3 to 4 days before lockdown interventions were introduced. So had we introduced lockdown measures a week earlier, we would have reduced the final death toll by at least a half.
The government and its advisors have always said that there needed to be a balance between the impact on the economy, the mental health of people going into isolation versus lockdown. Tonight, the Prime Minister was repeatedly asked if the government's strategy had been wrong and if they had locked down too late.
All I can say is at the moment it is simply too early to judge ourselves. We simply don't know the answer to a lot of these questions. What I can tell you is we know a lot more now than we did in January or February or even March. And one thing we really do know about tackling coronavirus is you have to proceed with caution.
Professor Riley's paper would suggest that the government did not proceed as cautiously as he would have liked.
And Victoria McDonald joins us now from the newsroom. Victoria.
Yes, John, we asked Downing Street for a comment tonight, but they passed us to the Government Office for Science, and we have not yet heard back from them. Now, it's interesting, you heard the Prime Minister there talking about us knowing a lot more than we did in January, February or even March. And to a point, that is, of course, true. But there were warnings. We saw them in The Lancet at the end of January, and we saw other countries going into lockdown. Italy, just 4 days after Professor Riley's paper was published. There were other scientists too saying we were being too slow. Now we have eminent scientists like Professor Neil Ferguson from Imperial and At the weekend, we saw Professor John Edmonds from the London School of Hygiene and Tropical Medicine also saying we should have gone at least by the 16th. Now, you could say this is all in hindsight, but the critical, absolutely crucial point here is that those delays could well have caused many more deaths. I mean, Professor Neil Ferguson was saying there that by going a week earlier, we could have saved 25,000 lives, and that will remain, regardless of what the Prime Minister says, the critical, really worrying point about how this has been handled.
Victoria McDonald. Well, joining us now is Devi Sridhar, who's Professor of Global Public Health at Edinburgh University and one of the scientists advising the Scottish Government. When we look at this warning from March the 9th, from a respected scientist, is that in line with what people were thinking, or is it sort of a strange outlier that would be easy to ignore?
Actually, March 9th was quite a late point to be worried about this. If you were following this outbreak since early January through February, what became clear is that the WHO declared a public health emergency of international concern on 30th of January. This is the highest level of alarm. And from that day, they had daily briefings warning countries of how to prepare. The virus would be arriving and you'd better prepare for it. So we knew a lot about this virus already, about the damage it could cause, about the number of people who would require hospital care in January and into February. We didn't need to wait till March even.
So when Boris Johnson said today, we just don't know, and we know an awful lot more now than we did in March, is that an excuse, if you like, for acting when we did?
Well, I would take it as the opposite. You have a virus that we don't know about. It's a gamble to see how it'll play out in your population. And the more we learn about the virus, the more dangerous it is, not only in terms of looking at the people who die, and now 50,000 people who've died of COVID over the past couple of weeks in the UK. Compare that to other countries who have had just a few hundred, but also about the people who live with long-term health complications, about those who are healthy before COVID and then after COVID are suffering from weeks and weeks of illness affecting large parts of their body, brains, kidneys, lungs. This is something that I think we're just starting to understand, which goes back to letting it go through the population as a gamble.
So are you saying that the government was gambling on 1 million lives, effectively?
Well, I mean, I wrote a piece after the 12th of March decision in The Observer called Britain's Gamble, and that exactly was what I saw it as, because there's a tried and tested public health playbook of how you deal with outbreaks. And this is what East Asia was doing. If you were paying attention to South Korea, Taiwan, Hong Kong, this is the playbook they were taking, which is aggressive containment, treat this like a SARS event, do your testing, do your tracing. This is what Vietnam did, India did, what countries did who contained it. And Germany and Norway, New Zealand, the countries that have done well, we're actually looking at East Asia and learning from those countries. Maybe we didn't fully understand the virus, but we knew what we had to do to contain it.
Now, you're talking to us from Scotland. When you look south at what we are doing now, unlocking, opening the shops, planning for opening the pubs, not the schools, but the pubs, does it seem to you as though the science has been thrown out the window?
Yeah, it's quite confusing and it feels quite muddled because it's not clear what your strategy is and what your objective is, and that has to be crystal clear. So is the strategy still to let the virus flow through the population and just to stay within NHS capacity? Then say that's your objective and then create a strategy around that. Is, as Scotland and the First Minister has set up here, to actually not let anyone be exposed to this virus who doesn't have to be, to drive down the number of cases, to try to get towards elimination, then you adopt a different strategy. So I think right now it's just muddled thinking because I'm not really sure about what the government's actually trying to do with this virus.
And what do you make of the fact that scientists are now saying, like Neil Ferguson and John Edmonds and others, are now all sort of coming around to what you've been saying for weeks, that they should have acted earlier? I mean, is this honesty or revisionism or what?
I mean, I guess it's good that everyone is looking back at the past few weeks and reflecting on their previous analysis and what we could be doing better. At this point, it's really easy, I guess, to look back and look at the mistakes and be incredibly frustrated and be very angry for all the lives who are lost. But I guess what at least I'm trying to do is put that aside and say we need to move forward. We need to find solutions. We need to actually get out of this crisis so more people don't die, more people don't suffer from being in lockdown longer than they need to be, and keep looking forward. We're all on the same side. We want our lives back. We want this virus gone. So why can't we just all commit to looking at what's happened in other countries, learning from those countries, listening to those countries, showing humility for the mistakes that are made, and move forward so we can, drive this virus to the margins. And my belief is if other countries can eliminate it, the UK is one of the richest countries in the world. Why can't we do it here?
Devi Sridhar, thank you very much.
Thank you.
And the number of deaths recorded today in Britain is 245 from the coronavirus. Now, from this weekend, the lockdown in England will loosen by one more step. Boris Johnson has announced that people who live alone and single parents with children will be able to team up in a bubble with one another in each other's family. They will be allowed to meet inside their homes without social distancing. He said it was targeted a measure to help people who are particularly lonely in the lockdown. Our political editor Gary Gibbon reports.
From Saturday in England, you can introduce another adult to your family group. That could mean a grandparent living alone, or another friend or relative living alone, a single parent who'd be allowed to bring their children too. The new addition can stay overnight and won't have to stay 2 metres apart.
From this weekend, we will allow single adult households, so adults living alone or single parents with children under 18, to form a support bubble with one other household.
It's modelled in part on the New Zealand government's build-a-bubble approach. The government here hopes it can learn from New Zealand's policy focus on kindness and supporting the isolated. But the Prime Minister said it must be an exclusive one-off choice of household, and those who are shielding are excluded. The Prime Minister confirmed all shops in England would be allowed to open as of Monday. At Prime Minister's questions, the Labour leader said that made the government's failure to get more pupils into school all the worse.
He made the announcement about schools without consulting relevant parties, without warning about the dates, and without any scientific backing for his proposal. It's time he took responsibility for his own failures. It must have occurred to the government that space would be a problem, that there would be a need for temporary accommodation and classrooms. They built the Nightingale hospitals. Why are they only starting on schools now?
Mr. Speaker, he still can't work out whether he's saying schools are not safe enough or whether we should be going back more quickly. I mean, he can't have it both ways, Mr. Speaker. It's one brief one day, another brief the next. I understand how the legal profession works, but what the public want to have is some consistency.
The Prime Minister repeated his plan to have all school-aged children back in the classroom in September, but he's badly off course in phase 1 of that challenge. And today he promised a big summer of catch-up for school children, with plans to be announced next week.